Hi, Banksblad here. Had a bit of an injury. Nothing to do with derby, it's just an issue I have. It has a name. Can't remember it. Sorry. Basically it means that my joints are a bit weird, like they're maybe a little bit deformed and worn. Apparently this is something that you can get naturally, like inherit it, like I'm pretty certain I got it from my dad. But it's also something if you have an injury to do with that joint, whether it's your knees or your elbow. My worst is my left knee, second worst is my left, the second worst is my left elbow, and my right side is not too bad, very minimal. And so basically what it means is where the shin, the top of the shin bone connects with the knee joint, and the top of the end of the thigh bone that connects with the knee joint in the middle, they're a bit worn and they've got some sort of gritty sand type things in there, which is what makes a really horrible sound, like stretching sound, when I bend my knee. I quite often have to unlock my knee and obviously my left elbow as well. Every so often, if you heard that crack, that was it. A few times a day, and it sort of makes a crack like, you know, when people crack their knuckles, similar to that. At times I do feel mechanical, like the movement feels mechanical in my left knee. I have had times after training sessions, this is quite a few months ago, where I actually felt like I was walking on stilts. At the time I just thought, oh, it's nothing, whatever, you know. But I'd say maybe about a week ago, I was laying in bed trying to go to sleep, and my left knee and leg were horrible. I had pain, like lightning go up my thigh and the back of my thigh and the back of my shin, and my knee was very, very uncomfortable, and I did have a slight numbness in the kneecap and in my foot, and this scared the living shit out of me. So I looked up online what type of doctors and that would be able to help with this type of thing, and found out that physios help with ligaments and muscles and nerves and all that jazz. So I looked up one in my local area and went to see her, and yeah, she said I have this condition, I can't remember the name of it, but basically it's something that I'm going to need continued physio work on to help maintain it. Yeah. So she did a few exercises, gave me a few exercises to do with the, it's a rubber band thing, yeah, to do every day. And she banned me from training for a week. I went back to see her this Friday, because I went and saw her Monday. So I went again Friday and had a really bad feeling that she was going to ban me from more training sessions. I was correct. She ended up banning me from training until Friday, because my training schedule is Tuesdays a really intense home team training session. Friday is a more light, advanced training session for the travel team, because I'm on the B team. It's still awesome, but you know, it's a little bit more light. And then Sundays is just a general advanced session. Every second or third, depending. Saturday is a full-blown scrimmage, closed to people in my league. use for training purposes to help us put the derby puzzle together. And every alternate Saturday that I don't do the scrimmage, I was hoping to do a boot camp, which I managed to get to one, and then heaps of scrimmages happened, so I'd much rather scrimmage than do boot camp any day. So anyway, that's my normal schedule. So I had a week without training, and now I've been told that I'm not training until Friday. And of course Sunday is Mother's Day. Last Mother's Day I did my level 3 assessment, because I knew I was going to pass, which I did. Level 3 scrimmage cleared in my league. So of course I have to repay the favour and not train and spend the whole day with Mum and that, because I ran a room from her, and not a good idea. Seems she didn't get to have me the whole day last Mother's Day. But anyway, that's my thing. So basically this week, 2 weeks after, yeah, I saw the physio. I'm going to have one training session, and then hopefully I'll go back to my usual schedule. But I'm a little bit worried, because yeah, it's just really scary. I mean, it's nothing major. It's just really annoying, but if I don't treat it, it could lead to something major. Yeah, so my first proper injury that I've had, which is affecting my derby thing. So fingers crossed after this coming week that it'll get back to really close to normal, which means I can train normal, and I'll get to a manageable stage and everything will be cool. But I have to wait and see, so okay, that's all.